Hello, I'm talking about how movement disorders, generally neurologic conditions, we're going to talk about how those relate to the mental health nursing setting. First of all, I think it's important that we try to define or decode or at least explain some of the different types of movement disorders as they relate to the mental health nursing setting. First of all, I think it's very important that we understand that what tardive dyskinesia is. Now, tardive dyskinesia is generally a combination of extrapyramidal side effects. Essentially what they are movement disorders that generally, though they can have a lot of different types of causes, in the mental health nursing setting generally are caused by long-term use of particular types of antipsychotics. Nursing journals and hear about on TV is Haldol or Haldol-Paridol, which is an antipsychotic drug. It has a lot of bad side effects, but one of those over the long term result of a neuroleptic problem that occurs in the body, and the person will develop extrapyramidal side effects such as lip smacking, which is like similar to a geriatric or elderly person who might have a Parkinsonian movement disorder. It's very similar. A lot of times they'll have, shaking hands and they'll have jerking, writhing movements. But generally, these are caused by long-term use of a lot of antipsychotic drugs. Now, this movement disorder, tardive dyskinesia, is completely different from the movement disorder Tourette syndrome. Now, Tourette syndrome is actually not even a mental health disorder at all, although patients with Tourette syndrome oftentimes have comorbidities such as anxiety or depression or obsessive compulsive disorder. But Tourette syndrome is actually a neurologic disorder where you have two motor tics, such as jerking of the head or excessive blinking of the eyes, or some type of movement, usually in combination with the vocal tic, such as clearing of the throat or grunting. If you've watched, TV shows, you'd think that everybody who has Tourette syndrome probably barks or yells or howls or something like that. That's actually cochlealia, which is a very, I wouldn't say rare, but it's an infrequent tic, because people with Tourette syndrome don't have seizures. They have tics because they have problems with the synapses in their brain that cause these uncontrolled movements. But it's completely neurological in nature. It has nothing to do with mental health whatsoever, except that it's a genetic disorder that's a neurological disorder that is in fact inherited. A lot of people, in fact, with Tourette syndrome take Haldol-Paridol. It's just kind of interesting because it can cause more movement disorders. But generally, when somebody takes Haldol-Paridol for a protracted period of time, the patient gets tardive dyskinesia as opposed to Tourette syndrome, because Tourette syndrome is, in fact, a hereditary neurological non-mental health disorder. My name is Nick the Nurse. I'd like to thank you for watching this video, and we'll see you next time.